Hello everybody, Namaste and greetings from my side. This is Dr. Vandit Malhotra, a surgical oncologist with specialization in molecular oncology. Also, I am the clinical lead for Art of Healing Cancer. This is about a middle-aged female with recurrent Ca ovary. So we use the CTC isolation technology in which the circulating tumor cells were isolated, and those CTCs were then grown in lab using 3D cell culture, and tumor viability assay was performed. That is, we tested all the available chemotherapy, targeted therapy, immunotherapy, and even off-label medicines to understand which works the best. Along with the mRNA expression of the different cancer pathways was also evaluated. So the patient had a advanced Ca ovary on presentation. She presented with ascites and peritoneal disease. She was given induction chemotherapy that was Taxol platinum based. She had a decent response. She underwent an interval cytoreduction followed by adjuvant therapy. The DFS was 16 years, and after 16 years the cancer recurred. So it was a serous Ca with downregulation of P53. And when it recurred, so it recurred basically in the paracolic gutters, in the area of peritoneum of rectosigmoid, at the vaginal fornix, also at the mesentery of ileal loops, the lesser omentum, gastrohepatic ligament. So then we looked into our analysis. What we found was that the taxanes were not effective at this point of time. Platinum was still there. So there was a very, very high expression of MDR MRP, that is the drugs of cancer resistance. For that we have to use certain methodology, specifically nutraceuticals and off-label medications to downregulate that MDR MRP. And when we looked into the transcriptomic analysis, it was a EGF pathway going through RAS-RAF. Also P53 expression was decreased. There was a very, very high expression of VEGF. And accordingly we made a treatment plan according to our analysis and what our team prepared, looking into all the literature and mapping those genes of transcriptomic analysis with the literature. We were able to make a chart of nutraceuticals and off-label medicines, and after 4 cycles of this treatment regime, when we looked into the PET scan showed a dramatic improvement. It was a more or less complete metabolic response to the therapy. Patient was clinically also much better, and I have had suggested the patient that she should consider a definitive surgery with, that is, secondary cytoreduction with HIPEC can be considered, or if she feels that is too morbid, a PIPEC can also be considered. But this was a very, very effective and dramatic response which we did not expect, and also with just 4 cycles. And it was good to understand the disease biology and make the treatment plan accordingly, so that we were able to understand that if we went back to Taxol platinum, our response would not be much. We had to downregulate the MDR MRP to make the cytotoxic treatment effective. Thank you and stay healthy. Thank you.